Now, the rules for CPR in a world where there's coronavirus and COVID-19 have changed slightly, because if we did normal CPR, we'd be opening the airway, we'd be checking for breathing, we'd be doing breaths as well, and this is a massive infection risk because you're then putting your mouth directly close to someone else's. So the chance of you catching a virus is near enough guaranteed. It's the perfect world for it. So UK Resus Council have changed the guidance. Now, around about 30,000 sudden cardiac arrests happen every single year in the UK alone, and around about 80% of these happen in the home or around family members. So this is not going to go away. People are still going to have a cardiac arrest if this is the example. Just because we've got coronavirus won't make any difference. So what we're going to do now is have a look at the rules and see the slight changes. Now, the first thing we're going to do is, once we notice the person's gone into cardiac arrest, and you'll see that what's going to happen, probably this has been witnessed, or you'll see them lying there and they're obviously not breathing, is we take the phone, we dial 999 or 112, and we ask for an ambulance, and then we put our phone on speakerphone, and you can lay that down by their head. Now, the emergency services will be able to talk you through exactly what to do. So if you're worried about what to do, they're there to help you. The next thing is because we're pushing down on the chest and because we're close to the person, we need to put some kind of barrier between them and us. So what we're doing in this example is using a piece of cloth. So this is a tea cloth, but you could use anything. You know, if you've got a jumper or something like that, put over the person's mouth and nose. But the important thing is we're not obstructing the airway, because as you push down and up and down on the chest, there will be air going in and out of the lungs, which is good because you are circulating some oxygen-rich blood around the body. The idea of this is just to pop it over their face, so that it's just taking any airborne particles of fluids are going to hopefully stay on their side of the face and not on your side. So as we're doing compressions, it keeps that moisture there, but don't put stuff in their mouth, don't completely block the airway, because we do want to have some movement of air in and out of the mouth. So once that area is safe, then your risks are reduced. Now, ideally, if you've got gloves and things like that to wear, great, but in most cases in the home, you're not going to have access to those. So emergency services are called, the face is covered, you know this person's in cardiac arrest, we are not opening the airway, we are not checking for breathing because that's far too high a risk, and we're going to go straight in with compressions. Same as you would normally. Interlock the fingers, arms nice and straight, center of the chest, shoulders over the person, and then we're pushing down 100 to 120 beats per minute, which is roughly 2 a second. So it's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now we keep going with that until the emergency services arrive. Now, ideally, they'll be there within 8 minutes, but it might be 10. Even at 8 minutes, even at 6 minutes, it's just really hard. So if there's someone else there to help, you can hand over to them. So they can go around the other side, maybe after 2 minutes of you doing it, then they have a go with 2 minutes and 2 minutes and 2 minutes until help arrives. Also, it's important that the compression is important, but just as important is the release. When you push down, you squeeze the blood out the heart. When you release, you let the blood suck back in. So compress down and back up, down and back up. And you're doing that around about 5 to 6 centimeters, which is quite a long way, but it's effective. So push down and release. Once you've done this, just keep going. Now, at the end of the CPR side, the emergency services have got there, then you do need to make sure you thoroughly wash yourself. Maybe if you could have fluids on you, you can change your clothes and do what you can to get yourself as clean as possible after the CPR has been finished. And finally, it's important that this person has an AED put onto them. Now, you're not going to have necessarily one of those in the home, but there might be one out and about, or you might have a community AED unit. So if possible, if there's someone spare that you can go and send for an AED, send them for the AED. When the AED arrives, then you need to follow the voice prompts. Now, if the emergency services are on the phone, they can help you as well, but they're very, very straightforward and they're very easy to use. And the AED could be the thing that brings them back even before the emergency services have arrived.